I mean, we don't have a drink, but we're here.
What happened there? I really thought that I'd be drinking by now, but you know, we had a busy Super Bowl, Valentine's Day,
Yes.
lots
How
of
was
fun
your
going
Valentine's
on.
Day?
It was nice. I got a little sus, a little present.
I'm sorry.
It was nice. What about you?
I had a date with a taco and an enchilada. It was amazing, just so you know.
Okay, well that's good stuff. I love that. Love that. Thank you so much for joining us. We've got Jennifer Moller, physician assistant, and myself, office manager, Newport Beach Dermatology and Plastic Surgery. Today we're talking about lips. Jen has kind of established herself, I think, in the Orange County lip arena as the lip queen. I am naming you that.
Okay, lip queen?
Lip queen.
I'll take
lip
it.
queen.
I'll take it.
So I thought, who better to talk lips than with Jennifer Moller, right? And I know you guys have questions. Some of you guys have already done lips before. Some of you guys have never done it before, and you're just like, what is all this about? So let's kind of break it down. First, can you guys hear us? I want to make sure everybody can hear us.
Somebody give like a thumbs up
Give
if
us
you
some
can hear
hearts
us.
or
Because we're in the
something.
bar. We're at the bar.
There's lots of hearts.
Lots of hearts. Okay, you can hear us. Great.
Okay,
Because
good,
we're
good.
trying out these little microphones, so that's excellent. So I want to share with you guys that you have an opportunity to win a syringe of Restylane Kiss filler, which is a type of filler.
It's one of my favorites.
It's one of her favorites for what?
I'm loving it. For lips.
For lips.
For lips, it lasts like a year. It lasts longer than any lip filler I've ever seen. And depending on how you do, what your technique is, you can either give a really full lip or you can give a really natural lip, which I think is fantastic that you have that. It's just all about technique.
So that's what you guys can win. So the way you win is that I want you to kiss and tell. That's our little, cutesy little thing. But basically, you're going to kind of comment to us about your experiences with filler or experiences that you're hoping to have with filler, and you will be entered in to win a syringe, okay? So that's how you win. We'll review it again later, but let's get to talking.
Okay, let's get to
So
it.
you touched on Kiss and why you like that kind of filler.
Yes.
And you said you can have a full lip or you can just add a little bit of volume.
Well, I think that's the biggest thing because I have patients that come in and they're so nervous because they don't want big, puffy duck lips. And honestly, I don't even know how to make that, to be honest. But I think that, you don't have to have that. It can be very natural and pretty. Like, you can just do a little bit so that your lips look hydrated. So as with age, we start to notice like little lines in our lips or even above our lips. And a little bit of filler can make it look soft. Or if you want like, a little bit of like voluptuous lips, ba-ba-boom, then you can have it. My motto is the younger you are, the proudier you can be. So you come on in and we can do more and more. But you and I are the same age. It's just, we have very natural lips.
Yeah.
Every 6 months or so we get a little lip filler.
But so for that person who's kind of afraid,
Yes.
there's no reason to be afraid because you can get whatever you want. You can say, Jen, like, I'm scared. I don't want it to be crazy. And Jen can pick a type of filler that will give you either just a hydrated look or to fill in those smoker's lines that she was talking about. There's so many kinds of filler that you can do in your lips. So kind of, if somebody's been going to another office and they've been getting something else, like kind of break down what we use, what you like to use, and why you like to use those things.
Well, first of all, I think we have every filler that's available on the market for the lips that we feel is safe. And if someone's really nervous, there's always Bellatero, which is just a really fine line soft filler. I actually use it for the under eyes. That's how gentle it is. But the problem is it goes away so fast. But if you want something very natural, then Bellatero is beautiful.
It's not going to give you a bigger lip.
No,
it's going to give you a smoothing
just soft.
out.
Soft.
To make you look like you just had a glass of water and your lip is hydrated, right?
Sure.
And then also you can use that for those people who maybe they never smoked in their whole life, but they call these smokers lines. You can fill in those sort of lines that go this way on your lip and not even touch the volume in your lip, right?
Absolutely. It's just, we have this little muscle around our lip and there are these little kind of grooves, if you will, and as we age, we lose the little bit of elastin and collagen, so our skin falls into the grooves. And even though you've never smoked, we can actually fill here and never put anything inside the lip. I do that all the time, but I'm always like, let me put a little in, let me put a little in.
I mean, I got to tell you, like, I'm kind
You
of...
have Kiss.
Oh, do I? I forgot.
Yes.
I forgot what I had in there, but I have a little something, but I don't like it crazy. I don't like to look too done. And I think the really fun thing after you get filler in your lips is putting on lip gloss and putting on lip liner, and you're like, oh, okay. So I've got a couple questions.
Okay.
Oh, I brought these two little things. I'm just going to cover this really quick.
Okay.
For the person who doesn't want to do filler, but like while we're on a budget, right? You don't want to do filler, but you want a little plumping. This is Dr. McNeil's MD Lip Perfect. It's going to just give you a little natural plumping. I have it on right now with just lip liner.
I'm sorry.
Yes. Good. And then I brought this because this is a little trick that I do.
What is that?
It's the peel and scrub.
Yeah.
So when I put this on my lips and I just kind of exfoliate them. And it kind of makes them really soft and supple, and just those are two little tips for people who aren't ready for filler but that they want, something for their lips.
But we're here watching and talking because we like lip filler.
We do, and you can do it however you want to do it, so don't be afraid. Were there any other questions that we need to cover?
Does anyone have a question right quick? Because we're happy to answer the fun little questions.
Somebody says, how do I prep for getting injected? That's a good question.
That's a great question. That's a great question. So, when you get injections, obviously I do have a magic wand, but it's kind of pokey. And you can get a little bruise and you can get swollen. So I just ask that you don't have any ibuprofen or any aspirin or any cocktails the night before. That will help minimize that bruising and the swelling.
And you can swell quite a bit after.
You can.
And it's nothing to be like, I think the way you look right after the filler is injected is what it's going to look like 3 days from. What do you think about that?
I think some patients start swelling immediately. As I'm injecting, I see it puff up. So I always tell patients they're about 25 to 35% swollen at the time of the appointment.
Okay.
And within a week, it's going to go down and be exactly what we want it to look like.
So 1 week after your injection is when you're going to have perfection. I know I've had the swelling, and then it's gone down, and I'm kind of
sad.
And then
you come back for more.
Yeah. Okay, so are there any risks to getting lip fillers?
There are risks. So, we're injecting hyaluronic acid, which is a gel. And the gel is injected into the tissue of the skin, right in the lip. And we can't see the little veins, and there is a risk if it's injected into a vein, it can occlude the vein, which means that the tissue around can no longer receive the blood. So basically, we are all very good injectors at the office. We take all the precautions to make sure our patients are safe. We've never had an issue with lip filler at all, but please make sure you go to somebody that is certified and has a lot of experience, because you just don't want a complication with someone in the office that can't deal with it, because we absolutely can if it ever happens.
And that's the thing. I mean, we do a lot of filler. Lots and lots. So we've got lots of experience, and we kind of know how to handle things. So that's my advice for that. Does it hurt?
Well, I'm not gonna lie. It's a little pinchy. Okay.
Pinchy. I like that.
Pinchy. We do put topical numbing cream on for patients. I myself, when I get injections, I no longer use numbing cream. I prefer for the injector to see my lip before it's all swollen from the numbing cream. But we provide numbing cream. We provide ice. But you are so much more comfortable.
And you have a very gentle touch.
Gentle Jen.
Gentle Jen.
Yes.
Yeah. So I mean, it's not like
it's
a party.
Not a party.
It's a party after.
But then you have it for Kiss is like a year. I swear, I've seen Kiss last a year. You do it once a year, it's worth it.
Okay, so different types of fillers for lips.
Yeah.
We've got Bellatero, we've got Kiss, we've got Juvederm, we've got
Restylane Refine for a really natural, pretty lip. I love Restylane Refine. We have, it just depends. Like if I have a more mature woman that her lip is really small, sometimes I'll use Restylane Define. I mean, it really depends on the patient's anatomy of her lip. And I can see it and say, this is what we need. I need more structure to pull it up and be able to build a lip. Or I just need something to plump it and make it really soft. It all depends on the patient.
Well, and let's talk about one other thing. You're talking about building the lip. What about this vermilion? What's Cupid's bow and all this? And like, what other things do you do around the lips? I know you do often too, right?
I am, yes. Okay, well, I'm secretly obsessed with the Cupid's bow. As you all know, heart, 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 we love that. So the Cupid's bow is just this little point here. And I think that we sometimes lose that definition. And so sometimes I'll just put a drop at each point. It's so feminine. It's so pretty. And it doesn't take a whole lot to do that. But let's say it's a patient that doesn't necessarily, they're not ready for lip filler. Sometimes I'll do 4 drops of toxin, which is Botox, Xeomin, Dysport, Jeuveau, right here. And what that does is it relaxes the muscle and it causes the lip to turn up ever so slightly. However, it's very temporary because we move our mouth so much. We're talking, we're eating, we're kissing. It goes away within like 6 weeks or so. But that's a great like introduction. Like, do I want lip filler? Just put a little hint of a little toxin.
Well, and then also the person that has that sort of always looks like they're frowning and not happy, you can sort of help them look a little happier, which is really cool.
So sometimes we have this like little downturn here. There's actually a technique that we inject to make it turn back up. And sometimes we do a toxin here too, but there's so many things lip for a second was the little 4 units here of toxin.
Okay.
Or I'll do filler, and I actually come from above. It's the Julie Horn technique, and I'll come above and I pull up. For an M-shaped lip, I have to do that to get it to pull up. So when I have patients that come in, they smile, and when they smile, their lip turns in, and they complain that they don't have an upper lip. So that's a lip flip. I'll come up and I'll fill this way so it pulls the lip up, and it's beautiful.
So we have so many tools now. So if you are looking at yourself in the mirror and you're like, you know what, I'm not really happy with my lips, there's lots of things that we can do that maybe you didn't realize we could even do.
Or you just want a little a little cute pout. Like, we're women. We want cute little, we want to be pretty.
What about men out there? Do you do lip filler on men?
I do, actually.
Yes.
I do. And you know what? Men, you need to step it up. I'm sorry, but us women, we're holding our end of the stick. Where are you at anyway?
Yes. Get in the office. We'll take care of you. Bree has been nice enough to film us.
Yes,
for this,
thank you,
this
Bree.
segment. Are there any things that we need to cover? Like anybody asking questions or anything out there?
Or do we need to when do we need to have them say something? So the bartender Michelle, who I met, she's lovely, can choose.
Yeah. Oh, well, let's review why we want you to say something. So
yes.
We're doing this whole thing called Kiss and Tell. The way you're going to win your syringe of Kiss, Restylane Kiss filler for your lips, is by sharing your filler experience on our chat. So, or commenting. Sorry, I get all these.
Just
terms.
make a comment, right?
Make a comment, and then we will enter you in to win the syringe. I don't think we're gonna be able to have her draw it though.
She can just scroll through and go whoosh, boom, and pick it.
Okay.
I think that's what we should do. Like the bartender Michelle, she's my new BFF.
Is there any questions out there?
Yes.
Questions, yes.
What are the questions?
One question asked, it would be nice to hide my gummy smile. Is that possible? I still want to look like me.
My what smile?
Gummy smile.
My
Gummy
gummy
smile.
smile.
So there's a couple things we can do. One, which I love, is you can put some Botox up a little higher than the lip flip. And so when you smile, it relaxes that muscle so it doesn't pull up. That is so easy to do. It's like 6 units of Botox. However, I'll also say, today I did a gal with lip filler, and we filled her lips because she was also complaining of the same thing. And at the end, she didn't need Botox because she'd smile and her lip was in. But if you're not ready for the filler, you can do Botox. It's just a little higher and a little bit more for the gummy smile.
Filler likely is going to solve that gummy smile problem, but you might need toxin if you're not ready to do the filler. That was a great question.
Whoever
But
did
see,
that, you're amazing.
This is what I'm talking about. If you're looking at something and you're seeing something that you don't like, we probably can do something about it. What else?
By the way, we're at Fleming's. I feel so kind of weird at the bar.
I know, we're at the bars.
Okay, anyway.
Natalia asked, how much is a good amount to begin with for lip filler?
It depends on your natural anatomy of your lips. So some girls will come in with no lips at all. You need at least 1 ml to even start, right? but I will never put in a whole bunch at one time. You have to gradually build that beautiful lip. It should never come out of one treatment, ever. So you start with one and you keep going. Now, some girls already have nice full lips. Sometimes we'll just grab a half syringe. It really depends on what you already have and what your goals are.
That was a really good question, Natalia. I don't know how old you are and what kind of lips you have, but there's every broad spectrum of lip types, right? Like some people start out with a little something already, and some people don't have anything. So it depends. We give that answer all the time. It depends. It depends. I'm sure that's so frustrating, but that's the truth. We really need to see you for an assessment. And you can, have Jen or really any of our providers.
They're all great injectors. Everybody
do these lip treatments. Any other questions that are just riveting, begging to be answered?
How often should you dissolve lip filler?
How often should you dissolve it?
Yes.
You should only dissolve it if it's bad.
Yeah.
So sometimes I'll have a patient come in and either it's migrated up here, or it's too full, and I like to start with a really fresh, pretty plate, and I'll say, let's just dissolve everything and start fresh. But you shouldn't really ever have to dissolve it unless it's bad.
I have a comment on that because I get this call from patients a lot, and they're like, oh, is something wrong? So it's not uncommon, and it is nothing about the injector or the product if you have a little nodule. Right?
Yeah.
So do you want to cover that, Jen?
So right quick, sometimes patients will come in and we'll do injections, and where we do the injection point, when it comes out of, sometimes there's a little ball. Well, I'll massage when the patient leaves, but usually you go and you go have lunch, or you go have dinner, or you're talking to your friend. So the filler can kind of migrate a little bit to where that opening's at, and you get a little ball. So I just recommend massaging it. Sometimes if it's left around too long, then we just do a tiny little bit of an enzyme to dissolve that little bit. But it shouldn't be like you shouldn't be dissolving on a regular basis. It should just be because there's an issue, which should be very rare.
That shouldn't be a treatment goal or anything. That would not be a normal sort of thing we need to do.
Yeah.
So we want to wrap this up because we know your time is so valuable, and we really appreciate you tuning in. Let us know what other things you want to hear. We're gonna see if we can get
I'm gonna get Michelle. Michelle's the bartender.
She's not even here. Maybe we should have Bree do a draw. So maybe a random to sort through. And we'll draw.
She was really excited to do it, but I'm not here.
I don't see Michelle.
All right. Well,
are there any other questions while we wait for Michelle?
No, that's good for now.
Yeah, sure. One person asked, can I use my lips the night of injection?
She's busy.
She's a busy girl.
So I always say, if you want to, have a little kissing session with your friend, it's okay, but it might cause more swelling. So any kind of activity that you have with your lips might cause a little bit more swelling. So, I've gone out and done hot yoga afterwards. Is it the best choice? No. A little bit more swelling, but you just live life. You're fine.
That was a great question. We love it.
So we have Michelle. Michelle's here. She's going to draw for us.
Okay, so...
If she just spin the wheel.
So maybe film her first.
Yes, let's Michelle from
Michelle. This is Michelle.
We love her. Oh, we need to give her some lips, FYI.
Yes, we do.
Okay, so all you're going to do is you're just going to scroll through the comments and then pick someone.
Okay, here we go. Who's the lucky winner?
So just scroll up and down.
Okay.
This is so exciting. We've never done it live like this.
All right.
Okay, maybe
Give it a good up, down.
Okay, up, down.
Here we go.
Okay, hold on. All right, you guys tell me when to stop.
Oh, that's a good
idea. Go.
You say,
Go.
stop.
I picked Jen Dober.
Jen Dober! Okay, turn it right back the other way.
Okay.
Jen, you won!
Congratulations. We'll see you in the office. Just
Oh my God, you deserve it. Thanks for joining us.